Okay, so
There we go.
yeah.
Great.
So let's
Okay.
see everybody's answers.
Yep. Next.
You tell me that when to go to the next, and I go to the next.
We can go to next now.
Okay.
Okay. Okay. I think everybody should be able to.
Yes. Okay.
Perfect. Yeah.
Okay.
So.
Okay. Then now.
People are still doing it, but I think they got it. Yeah.
Yeah.
Okay. This is. Let's give some time for this one
Yes.
to people.
Yes.
Okay. Okay. So what about saccades? I'll give people time as they're
They're still answering. So you got 27 people answered. It's telling on top how many people have answered. Let everybody answer.
So just so you guys know, it can be all of the answers can be correct
select
also.
multiple answers. You can select multiple answers also. It's not necessarily one answer. In some questions, it will be one answer. In some, if there is that check thing, you can select multiple questions. Okay, so at least 60, 65 people.
Yeah.
Most people are answering. Yeah. Give them time. I think because it's still beginning, let's give them time to answer.
Yeah. Okay, it looks like it's stabilizing, right?
Yes.
So,
yeah, so let's stop there. Has anybody got any problem in answering? You can raise your hand. Otherwise, I think we go ahead.
Okay, so let me just discuss this question since it was eye movements and saccade. So although it's not directly relevant to gaze holding, of course, there is some relevance to gaze holding, right? So, the response to this question is all of them are correct, right? So saccades are used to look into the right place. You want to move your gaze from point A to point B, and the way you do that is by making correct saccade, right? Your saccades have to be correct velocity. If there is too slow, then it's a problem. Like certain neurodegenerative disorders like PSP, for example, the slow saccades. Latency is very important. When your eyes are supposed to move from point A to point B, they have to move promptly. If they don't move promptly, that's a problem. So, it disappeared for some reason.
Okay, no, sorry. Okay.
Okay, and then certain kind of neurodegenerative disorder, especially certain dementias or certain forms of apraxias, for example, or cerebellar disorders, they would have increased latency. So it's also very important. Of course, the saccade cannot be too big or too small. A lot of cerebellar problems per se can lead to what we call dysmetria, which is like hypometria or hypermetria, right? So hyper means too big saccades than what they're supposed to be. Hypo means too small. So then in that case, they have to make catch-up saccades, right? So, or you can't have just too many saccades or too few saccades. If there are too few, that means that your brain is telling your eyes to make a saccade, but your eyes are not making it. Like, again, comes down to apraxia or increased latency, right? Or if it is too many, sometimes they're intrusive when saccades are not asked for, they just spontaneously happen. And if that happens, especially, let's say if I'm reading this question, right? I'm reading what about saccades, makes. When I'm looking at make, and if I make another saccade and it jumps to active pole, which says on the top over here, that's a problem, right? So I have to not make saccade when I don't want to make saccade. So if there are too many uncalled for, that's also a problem. So the answer to this question, all of them are correct. You need to have all of these to have ideal visual experience. We can go to the next slide now. So basically, we essentially talked about these 10 rules that I learned from my mentor, David Z, who is here, and John Lee here. And these 10 rules have helped me tremendously as I practiced neurotology and eye movement neurology, or neurology in general, per se. So, of course, first of all, if you're looking at somebody's eye movement, you have to make sure that you have the preliminary, right? So you have to make sure that person can see. And their acuity is all right. So I typically keep the pocket vision screener with me, or sometimes, like, you know, in the clinics, you can have the test chart hanging on the wall as well. You can use either way, but you have to make sure that they have good vision. You also want to take a look at fundus. I don't expect everyone to be an ophthalmologist to look at the detailed fundus, but you need to just look at the basic things, that they don't have cataract, or they don't have any major problems that can prevent vision. And of course, lids are very important. A lot of times as neurologists, when you're asked to see patients with neurodegenerative problems, they may have lid apraxia, or they may have blepharospasm, or certain myasthenics, they may have litosis. You have to make sure that they can keep their lids open. If the lids are not open, they cannot see. So that's very important. Then, of course, another very important thing is you have to make sure that you keep the distance. You don't have to be far from patient, but the target has to be far from patient. So what you're seeing here is typically I keep patient here. I stay on the side, so I'm not in their visual field, and I ask somebody else, or I keep a target far away from patient, typically 6 feet, 10 feet maybe, depends which room I'm using. Far away from the patient, and then I ask patient to look at their target. And the whole idea of keeping good distance between patient and the target is that if target is too close, they have to make convergence. I cannot see myself on this video here right now, I think, but if you can see my hands, if eyes are converging because they want to look at the visual target, then convergence can suppress certain forms of nystagmus. So you have to make sure that the target is far enough. The other important thing is that when you examine the saccades, you have to give them a target which is bright target. So what I typically do is I ask them to show something like this, thumb and a pinky finger, or I show them the pen, which is horizontal, and I hold pen horizontal and ask them to look right, left, right, left. So that way they're not making a very big excursion, because a lot of times if you're looking at older people, you want to check like rather decent sized cards, but not too big or not too small. So I typically use my hand. I hope everybody's able. Thing is the target, right? So you want to make sure that. So a lot of times, what people do is like, look at my thumb. Now look at my like this. He do like this. Like, look at my thumb. Now look at my thumb. Look at my thumb. You don't do that. If you do that, you're not really looking at the saccade. You're looking at the way for them to track your thumb at the velocity of your thumb, not at the velocity of your eye. So what I do is I just ask them to do something like that. Show them my finger, thumb, and a pinky finger, right? And I ask them to look at the thumb, look at the pinky. And what all they have to do is move their eye from my thumb to pinky, which is not too big of a distance, right? So that makes a decent sized saccade. And that gives you a very good measure, sensitive measure of a slow saccade. Because if you do a big excursion, sometimes that can give you an illusion that they are slow when they're not slow. Then I also keep the object bright. So remember, a lot of our patients are elderly, right? And when they're elderly, they may not have necessarily good vision. And in that case, you have to make your object as bright as possible. I try to keep like red color object, which is typically good for almost everybody. You have to make sure that you check the alignment of your patients. What I do is I keep the occluder on me, and the type of occluder that I like is the one which is more translucent. So if you cover one eye, you can see the covered eye, but the person cannot see out of that covered eye. So that gives you a very good vision. Let's say, for example, if you occlude the eye, as you can see here, this eye is kind of moving in like esotropia. So what you can do, if you had occluded this, then you would be able to see it, but the patient would not be able to see out of it. So it's very important to use that type of occluder if you have it, and it's not that expensive either. You can get one for a few dollars. And of course, you have to be very mindful for patients' age. So as you all know, a lot of our patients are elderly, especially when they have neurodegenerative disorders or when they have cerebellar disorders or they have strokes. In these patients, their orbital muscles sometimes get atrophied. And if they get atrophied,
It's
they may have
again become blurred. Is there something wrong with the net connection today? I don't know why. It's again become blurred, no, Manasi?
It's interesting.
Yes, sir. Yes, sir. It's become blur again.
Is it
The slide
jumping?
before this was clear, but this one is now again blur.
Yeah, it had come. Can you just try logging in again, Asif? Maybe.
Sure.
And
yeah.
so if you could also check the internet.
Yeah. So is there some VPN or something connected? Nothing like that, no?